Hi, I'm Gerson Borrero back with the City and State TV special coverage of the Cuomo to Cuba or Cuba finds Cuomo, whichever it is. It's part of our coverage of the governor's trip, which he makes on April 20th. We're sending Jonathan Lentz there to cover it for us and be able to report from there. We have a special issue of our magazine that will be out soon. But we're conducting interviews as part of this trip of New Yorkers that are going to Cuba. And Sara is your last name. You are traveling to Cuba as a health person, a person who is in the field of health. Where are you from originally, Sara?
I'm originally from the Dominican Republic, was born there, been in New York City for almost 40 years.
And is this the first time you go to Cuba?
Not the first time. I went to Cuba about 6 years ago through the Dominican Republic, since I have dual citizenship. And it was a fabulous experience. I went on my own and just walked the streets of Cuba, met people in Cuba, saw the children in school, visited some hospitals, and I was just totally impressed. I'm from the Caribbean, and I just love the work that's being done in Cuba. I've been to Venezuela and see the doctors working in Venezuela as part of the Cuban exchange. It is just fabulous. This is a great time for people to go visit Cuba and really see the people there and see what's happening. It's more than what you hear, and it's certainly not what you hear.
Part of the experience here that the group that is going with Cynthia and Mickey, who we'll be interviewing later, is a cultural, educational piece. You're in the health field. What is it that Cuba has that you can learn from, or that we can learn from as New Yorkers, as people in the United States, as we open up with all the needs that are real and the government admits to it? The health system in Cuba that you know or beginning, or do you want to know more about it? What is it that is different? What is it that they're able to provide for Cuban citizens that we don't hear?
Well, the first thing I'll say is health care for everyone. That's what's in Cuba, universal health system. I've been there, I've seen how it works, and here we have a long way to go before that happens. I'm a big proponent of universal health care, and I think Obamacare has done something to get there, but we certainly have a lot of people who are not covered, a lot of people who receive suboptimal care, and in Cuba it's provided to everyone. I have friends who've experienced illness in Cuba, and they just go into a hospital, they get treated, they pay nothing, and we need to learn from that. And one of the things that I intend to do is go visit some hospitals and just see how it's done, because in Cuba, healthcare is free, and it should be free to every citizen of this country.
Some people argue, and I've heard the arguments, and I haven't been to Cuba, I've never visited, and I'm still a long way from going because of circumstances, but they also say that yes, that is true. There are advances in the healthcare system, but sometimes the hospitals don't even have bed sheets or aspirins. Have you seen that, or is it the first time that you're actually going to go into hospitals to see firsthand what's there? We know that the medical care is advances, and even in the areas of cancer and treatment of other serious illness. On some of the basic needs, is the criticism warranted?
It's not warranted. On my trip before, I went to a hospital. Cuba is a country that certainly, with the blockade, a lot of things have not, happened in Cuba. But it's not because the Cuban people do not try. If anything else, they have been able to make things happen out of having very little. And healthcare is something that, as long as there is access to care, everything else sort of falls into place. And I think that, yes, can some things be improved? Absolutely. But initially, if everyone has the same access, that's where it all begins.
Sara, thank you so much for City and State TV. Good luck on the trip to Cuba, and I hope you can bring some of the experiences and apply them here in the health field. So best of luck. Una hermana dominicana via New York, traveling to Cuba. We'll be right back. Gracias a usted. We'll be right back at City and State TV. Gerson Borrero reporting for all of you, and we'll be right back.